Elephantiasis, medically known as lymphatic filariasis, is a chronic tropical disease that causes extreme swelling, typically in the legs and arms. The condition occurs when the body's lymphatic system, the network responsible for draining fluids and maintaining immune health, becomes severely damaged and blocked, leading to massive fluid accumulation and skin thickening. The primary cause of lymphatic filariasis is a parasitic infection transmitted by mosquito bites. Microscopic, thread-like roundworms, most commonly Wuchereria bancrofti, enter the human bloodstream through a bite. Once inside, these larvae travel to the lymphatic system, where they mature into adult worms. These adult parasites can live inside the lymphatic vessels for years, slowly disrupting normal fluid drainage. Over time, the immune system's response to the worms causes inflammation and irreversible tissue scarring, leading to the dramatic enlargement characteristic of the disease. Beyond parasitic infection, similar severe swelling can stem from non-filarial causes. Podoconiosis, for instance, occurs when individuals walk barefoot in areas with volcanic soil, absorbing mineral particles that trigger a chronic inflammatory reaction in the lymphatic vessels. Severe secondary lymphedema can also develop from localized trauma, surgical removal of lymph nodes, or advanced tumors blocking fluid pathways. So managing the condition requires a combination of antiparasitic medications, rigorous skin hygiene to prevent secondary bacterial infections, manual lymphatic drainage, and compression therapy to relieve pressure and preserve mobility. Because a parasitic infection caused by microscopic roundworms, Wuchereria bancrofti, Brugia malayi, or Brugia timori, transmitted through repeated mosquito bites, habgenicanism. The parasites nest in the lymphatic system, blocking fluid drainage. Over time, this leads to profound swelling, lymphedema, fluid accumulation, and skin thickening or hardening, and non-filarial severe lymphedema has primary lymphedema. A congenital or genetic abnormality in the lymphatic vessels, present from birth or developing later in life. House congenital lymphedema, damage or blockage to the lymphatic system caused by trauma, surgery, deep tissue infections, or tumors, podoconiosis, endemic non-filarial elephantiasis, chronic exposure to irritant mineral particles in red clay soils, common in high-altitude agricultural areas, in individuals who walk barefoot. Key symptoms to monitor HASMAC fluid buildup, heaviness, and difficulty moving the affected limbs, skin changes, such as thickening, hardening, hyperpigmentation, or deep folds, secondary bacterial or fungal skin infections due to impaired lymphatic drainage, medical management and care. A formal diagnosis requires evaluation by a medical professional, such as an infectious disease specialist or vascular surgeon, which may involve blood tests, ultrasound imaging, or specialized lymphatic scans. Medications. Antiparasitic drugs, such as diethylcarbamazine, ivermectin, or albendazole, are used if an active parasitic filarial infection is confirmed. Lymphedema management, meticulous skin hygiene, elevation of the limb, specialized compression therapy / bandaging, and manual lymphatic drainage techniques. Infection prevention, prompt treatment of any cuts or skin breaks with antibiotics.